Good evening, everyone. My name is Swana Leos, and I'll be presenting on biomedical ethics concerning allocation of healthcare resources. Okay, so these four prima facie principles will govern the ethical concerns highlighted in the following cases. We have autonomy, the right to make one's own decisions, beneficence, the act of doing good to others, non-maleficence, the obligation of not inflicting harm on others, and justice, the principle of practicing fair treatment. Now let's have a look at case number one. Here we identified three main prima facie principles. First off, we have autonomy, and we could see that Mr. S was deprived of his autonomy to receive dialysis treatment by being subjected to discrimination. Moving on to non-maleficence, the hospital does not respect the principle of non-maleficence by refusing to provide adequate health care to Mr. S, which could result in prolonged suffering and premature death. Okay, so moving on to justice, and first off, we have distributive justice, and we could see that there was conflict in this type of justice where the issue of limited resources did not permit equal distribution of dialysis treatments to all patients. Access to dialysis treatments was only permissible if the patient suffered from acute renal failure and conditions were reversible, or in the case of Mr. S, if the patient was eligible for a kidney transplant. Since Mr. S did not fit neither criterion, he was denied medical attention and thus received unjust treatment. The second type of justice would be violation of Mr. S' human rights. Mr. S was treated unfairly. He was denied medical treatment by the state hospital because of his chronic illnesses and thus was subjected to discrimination. Also, since Mr. S' finances were depleted, he was subjected to discrimination by the private hospitals and was denied further dialysis treatment. And the third type of justice would be violation of legal laws. And Article 10 of the Universal Declaration on Bioethics and Human Rights says that the fundamental equality of all human beings in dignity and rights is to be respected so that they are treated justly and equitably. The health institution did not oblige to this legal law by having a policy which encourages inequality and denying Mr. S access to much needed medical treatment. Now let's look at possible solutions for this scenario. The first one would be that the hospital could provide Mr. S with the necessary treatment. The state hospital can revise their policies by allowing input from stakeholders, including the government and patients suffering from chronic illnesses, considering the ethical concerns mentioned earlier. The government has a duty to provide treatment to its citizens despite severity of illness or economic background. Therefore, allocating sufficient funds for healthcare resources should be prioritized to reduce the practice of inequality and preserve patients' self-worth. The implementation of preventative measures such as education or early screenings will reduce the likelihood of persons being diagnosed to chronic illnesses such as diabetes, therefore not imposing any strain to already scarce resources. To conclude, let's look at Mr. S' health condition. Mr. S suffers from a variety of illnesses, which led to a stroke and chronic renal failure, and thus he has a slim chance of surviving due to his already fragile health condition. Therefore, I believe that the hospital made the right decision in refusing regular dialysis treatment to Mr. S, and by providing such services to Mr. S would squander the already limited dialysis resources available. Additionally, the lack of healthcare resources means that the country is probably poor, and thus misuse of those limited resources would increase the financial burden on the government and tax-paying citizens. As a result, those limited resources can be more beneficial to other patients whose health condition is less severe and have a greater chance of having a prolonged life. However, I do believe that some form of medical attention should be given to Mr. S to alleviate his pains and sufferings, which would in turn preserve his dignity. Okay, so let's look at case number 2. Okay, so in this case, we identified 4 prima facie principles. For autonomy, there was evidence of conflict between professional and personal autonomy. Ms. Rees CS respects the principle of autonomy by wanting the right to decide on what medical treatment is best for her. Her interest of using an unconventional drug, which may probably alleviate the symptoms associated with the illness, should be respected. On the other hand, the hospital respects the principle of autonomy in providing fundamental care to Mrs. CS by prohibiting the use of unapproved drugs based on their professional commitments. However, we could see that Mrs. CS autonomy was violated since she was refused treatment that she would like to receive, and the hospital limited her autonomy by having a paternalistic view by forcing her to be part of a conventional healthcare system that was clearly no longer working for her. So we move on to non-maleficence. The hospital has an obligation to not inflict harm to Mrs. CS. However, with the hospital not forthcoming in providing the alternative drug to Mrs. CS, added to the fact that all other treatments offered by said hospital have proven to be ineffective, Mrs. CS' chances of a prolonged life is reduced. On to beneficence. We could see that the hospital respects the principle of beneficence by ensuring safety to Mrs. CS and other patients in refusing to provide unapproved drugs that may cause harm or shorten their lives. From the viewpoint of the hospital, they are exercising good judgment, which will deter additional trauma and pain to the patient. And for the final principle, justice. There was clear evidence of the violation of Mrs. CS human rights, her right to fully choose her preferred medication, given that all other possibilities were already exhausted. Now let's look at possible solutions in resolving this case. So the first one would be seeking assistance from another hospital or physician. So since the current hospital was not willing to provide the alternative drug to Mrs. CS, she had the option of relocating to another hospital, which would not prohibit its use, and thus allowing Mrs. CS to exercise her fundamental human rights. Another solution could have been experimental treatment. So the physicians at the current hospital should have discussed the option of experimental treatment with Mrs. CS and possibly refer her to one. The experimental research should be at an advanced stage and is usually deemed relatively safer since they are usually governed by strict legal and ethical guidelines. However, a similar problem can be faced as the use of the unapproved drugs, the results from research treatment is usually unpredictable and poses possible detrimental effects on the patient's health. In conclusion, I agree with the hospital in refusing to treat misuse CS with the alternative drug to avoid causing damage or even death, which may lead to possible lawsuits from the family. However, I believe Mrs. CS should have been referred to another hospital where she can use the unconventional drug for treatment. Since Mrs. CS has been unresponsive to all other possible treatments, it should be understandable by the medical personnel that a new treatment is required to alleviate her pains and suffering. Additionally, Mrs. CS health condition is poor and she is basically on her dying bed. Therefore, there should be no objection in exploring unconventional alternatives that would at least alleviate her symptoms. So we have come to the end of this presentation. Thank you for listening.